Williams. I'm the CEO of UICC, and in our series of conversations, I have the pleasure to talk to, well, I would describe him as a friend, Manica from GuardP, who's a partner for UICC on the issue of antimicrobial resistance. So Manica, I'll let you introduce yourself and also talk about what GuardP does.
Great, thank you, Cary. So I'll introduce myself. My name is Dr. Manica Balasegaram. I'm a medical doctor by background, trained in internal medicine. And I'm actually currently the executive director of GuardP, which is the Global Antibiotic R&D Partnership. And we're an organization that was co-founded by the World Health Organization and the Drugs for Neglected Diseases Initiative. And our mission is really to accelerate the development of new and improved treatments to address antimicrobial resistance and particularly bacterial infections, and ensure that these are accessible and available in an appropriate way. So we were created in 2016 and became a legal entity in 2019. So we're a very young organization. And since then, we've built a portfolio of projects ranging from a very few early stage projects to mainly, that's probably where 90% plus of our budget is, to late stage clinical projects going into, I would say, market authorization and then beyond into early access. Just add a couple of points, which is we are really focused on a kind of global health perspective. So we've started to focus on a few key areas such as bacterial infections that are particularly occurring and drug-resistant infections that are particularly occurring in hospital settings, as well as focusing also on newborns and children. And then we have a project that's more on a community-based infection, which is sexually transmitted infection. So they're each quite different from each other. But the essential theme is we want to really ensure that these are going to be available around the world, particularly to heavily impacted high burden populations. And that's a very, very important principle for us as an organization.
And I think probably people are wondering why we're wearing the same shirt today, Manica, because we're in the middle of the World Antimicrobial Awareness Week. And of course, we're encouraging people, organizations to go blue this week to show the multi-sectoral challenges that we have on antimicrobial resistance and the importance of antibiotics. So it seems to me it's something which is growing in importance and understanding, certainly across the cancer community, which is why the UIC is involved in this. So, I mean, it's an important week, isn't it? How important is it to you that the world becomes more aware of the challenges that antimicrobial resistance actually poses to the communities in the future?
Yeah, that's a good question, and it's a hugely important issue. And I also want to say why it's going to be important for the cancer community and why I think it's been really important that the UICC has got involved in this issue. So just to say off the bat, the problem is that this isn't a kind of specific disease in its own right. You don't get diagnosed with antimicrobial resistance or AMR. Often it's not even notifiable. So it's something that just happens in the background. There are more efforts to look at surveillance and to understand what is happening across the world. But this is an issue that's happening in kind of all corners of healthcare and even beyond healthcare, actually. So to give you an example of that, antibiotics are kind of used in a very kind of cross-cutting transversal way across health systems. And I would say it's used in a very cross-cutting way, both in human health and non-human health, so in animal and agricultural use. And therein lies the problem, because it's just there as part of the background, as part of the infrastructure, something we take for granted. And we only start to understand that there's a problem when it doesn't work as well as it used to be. And so I can give you an example of the type of things where antibiotics are important. Obviously, to treat barn door infections, like when you have a pneumonia, for example, or you have a very bad kidney infection. Sometimes that can lead to a bloodstream infection, which can manifest into sepsis. Sometimes it can be an infection in a newborn baby, which are very vulnerable. And this is a major cause of killers of newborn babies, actually, not just bacterial infections, but antimicrobial resistant bacterial infections. So it's clearly a problem there. But then there's a more kind of subtle aspect to it, which is the way that we have, I would say, are able to deliver medicine because we have the I would say, capacity to deal with the complexity of the care that we have to give. So to give you an example of that, surgery. Mortality in the early days, 100 plus years ago, there was fairly high mortality associated with surgery and trauma and these kind of problems in medicine because of secondary infections. It was very, very common to get a secondary infection or an infection after the surgical intervention, especially if it was done in a hurry. And people realized that they had to put in measures like, to prevent infections, but they also recognized that no matter how careful there was a significant risk. And it was only with the advent of antimicrobials that we could start to do, in a safe way, increasingly complex surgical interventions. Let's look at chemotherapy as a good example. There's been a massive revolution in cancer care in the last 50, 60 years. Has anybody thought whether that would have been possible without antimicrobials? The type that we're able to kind of test and develop, cancer treatments that, effectively zap your body, zap your immune system and zap the cancer. But in so doing, render you extremely vulnerable, particularly to infections. And would any of those treatments be available today? And if we didn't have antimicrobials as a kind of safeguard to ensure that we could appropriately develop and actually make these treatments available to people across the world. And let's look at new innovation that will come out in the years to come. The same principle applies, except now we're faced with the dilemma that we may be providing cancer care and then surgical interventions for cancer, where we may see far less successful outcomes, far riskier outcomes, and an impact on sickness, recovery, and potentially even survival. So this is quite a serious issue in that sense. It's a threat to the entire way of how we practice medical care and what we as a society take for granted on what medicine can do for us today and how it can look after us and prolong our life and improve our quality of life.
Yeah, Manica, that's so true. I mean, and the reason that the UICC is committed to work with you and others on this particular issue is, as you quite rightly say, if we do not address the challenges of AMR, then all the benefits of the advances in cancer treatment that we've seen in the last decade and hopefully in the next decade may actually be thrown away, because the cancer treatment may lead to death because of infection. And so that's why UICC and this board made that decision just over a year or so ago, that we needed to raise the profile of AMR in collaboration with others at a government level to ensure that there was a general understanding on the threat that this poses in the longer term to the success of all the treatment advances that we're seeing in cancer. So Manica, there seems to be two issues. The first one is the overuse of what we've got today. And also there seems to be a lack of investment in new antimicrobials for the future. Over the last decade, I think we've all become concerned that investment is simply not there. So what do you see as the challenges and how can we resolve those?
Yeah, so I think that's a very good question, Cary. And as you alluded to, this is a kind of multifaceted problem. On the one hand, you've got an issue where there is significant use and misuse of antimicrobials. And this happens both in human and non-human health, and there are efforts being made to try and address this. But even if we significantly reduce the unnecessary use of antimicrobials, we will nonetheless have resistance developing at some point. And this is just something that will happen. It's the response of the bacteria to external insults that are thrown at it. It's the way that they will evolve to get around the problem. So I think at the end of the day, what we will still need over time is a continually developing arsenal of antimicrobials. These could be traditional or non-traditional approaches. But I think what has happened, unfortunately, over the last 3 or 4 decades, as there has been a significant slowdown in investment and in innovation in this space. And that is largely, I think, an economic, and I should actually say a socio-economic problem. Economic in the sense that it's become increasingly more complex, it's expensive, but far less commercially, I would say, rewarding and lucrative to develop an antimicrobial, especially when you compare it to other therapeutic areas like cancer. And of course, at the same time, I would say society at large has been very slow to recognize this emerging problem and hasn't really corrected this issue. So that's why I say that there is a big social element to it. There is now recognition that there needs to be significantly more investment, and this needs to be done in a variety of different ways. However, I would add the point that even with the antimicrobials that we have, we've had some new antimicrobials that have come onto the market in the last few years. The availability and access to these antimicrobials has been extremely limited to a handful of countries. So we have an additional problem that we need to solve, which is not just ensuring innovation, but we need to ensure access. And I think people understand this issue now because of COVID-19. They recognize that we can't just develop these new wonderful tools like new vaccines. We have to make them accessible and available and deploy them the right way. And this is the concept of what we talk about when we talk about preparedness. We need to have and ensure access to countermeasures to prepare for infectious disease threats for tomorrow. And this is antimicrobial resistance is par excellence one of those issues that we absolutely need to address, with the big advantage that we know what we can do and what interventions we can put in place to address. So I don't want to sound all grim and bleak about this. I'm actually fairly optimistic that we can actually address this problem, but we need, I think, a big political push and big political will to actually, I think, put the resources and the effort to do this.
And that's why the cancer community is involved, Manica. We believe that what we can bring to the table is a community of 1,200 organizations in 173 countries who, with the knowledge about the issue, can actually push at national level and international level to support your ambition to address this long-term issue. So hopefully we can work together in the next few months, few years to make that ambition a reality. And certainly I know that you appreciate the cancer community being behind the issue.
Yeah, indeed. I'll just respond to that by saying that there is a lot of things I think that the cancer community can do. I mean, just off the top of my head, I would say one of the first things is that the cancer community can collect information about what's happening in cancer care, how that's being impacted by, I would say, the declining effectiveness of antimicrobials. And that can be a phenomena that can be noticed simply by oncologists, for instance, noticing that they're having to escalate and use more complicated antibiotics to treat what would have been easier to treat infections in the past. That's a kind of clear warning sign, as an example. I think another thing that the cancer community can do is really be a strong advocate, because as I mentioned right at the beginning, antimicrobials are an important fundamental aspect that is required for successful cancer care at a community and public health level. It will be extremely difficult to deliver successful outcomes without effective antimicrobials. So it's very much in the interest of, I would say, all the stakeholders in the cancer community to do this: individual patients, healthcare providers, governments, and industry as well, because they have a huge vested interest in the successful application of the chemotherapy agents that they are producing but the ones that they will also develop in the future. But I think you also have a very powerful voice, and I think this is something that I think you have to understand. In a way, you have a responsibility, if I can put it this way. Us in the kind of infectious disease antimicrobial space, particularly bacterial infection space, we're a small community, and frankly, what we do is what we say in French, bricolage, DIY, if I can put it this way, as far as advocacy and communications are concerned. I think you as a group have been much more, I would say, used and experienced in, I think, conducting communications and advocacy in order to achieve better outcomes in cancer care. And I think it's bringing as well that experience and expertise that it's going to be really important that you can be, a game changer, I think, in this space. And the last reason that I would say is that at the end of the day, we're all going to be needing antimicrobials at one point in our life. I can probably put money on that fact that, the majority of people are listening, this probably has had an antibiotic at one point in their life. And as we live, hopefully live longer, we will all undergo medical care at some point in our life, and we will all probably require the use of an antimicrobial agent. And so it's in our own interest, as well as societal interest, to do something. And I think the ones that have the ability and have, I would say, the know-how, I think really are in a good position, I think, to make a change and an impact here.
Well, you certainly have the commitment of the UICC behind the work you're doing, and we see it as a joint effort. We are going blue this week, Manica, so we will be encouraging others to go blue to make sure that we raise awareness. I've got to say thank you very much for talking to us. It's a subject which probably wasn't on the agenda of the cancer community 2 years ago, but it is now. And hopefully at the World Cancer Congress in Geneva next year, we can bring the community together and talk more about this subject and ensure that we're working as one team. So thank you very much for your time, Manica. Really appreciate it.
My pleasure. And I look forward to working together in the future further.
Bye-bye.